What's your views on the West Midlands people coming in their review of the services and what they've found so far?
I mean, firstly, it's good that we have some external scrutiny. I think there is a real risk for the Isle of Man to sort of lock itself away and not benchmark with others. I'm not entirely convinced that the UK is the best health economy to be benchmarking ourselves with. As I say, I've picked up...
You got a better solution? Which one would you like to?
Well, we've got lots of systems out there
Which one would you like?
That work quite well. Well, I think I want one that's right for the Isle of Man. I don't want to... But
an external reviewer from where? If it wasn't the UK, where?
Yeah, no, I'm not saying that we don't get a perspective from the UK, and that's where I think the West Midlands work is right. I think we need to also get a strong feedback from the customers, the Isle of Man residents who use our service. Our feedback mechanisms, and indeed I would suggest I want to strengthen the complaints arrangements so that actually the intelligence of the people using the service is important and helps us drive improvement, as well as the feedback we get from West Midlands and anywhere else we can get it. I want to look at other systems, and I want to look at what other areas of health and social care do well and how we can bring that here.
So out of 10, where would you put the service as it is today, and where would you like to take it?
Well, there's different parts of the service, so that's a very difficult question to answer, because clearly we've got social care and housing, and we've got community health. And the important thing for me, actually, it's the sum total greater than its parts argument. I can understand why there's the temptation to just focus in on the hospital. Absolutely. But actually, the whole system will only work if all of those dots are joined. And the sum total of that is far greater than its individual parts. So absolutely, we've got to improve the outcomes that are delivering and being delivered in the hospital service. Part of that is how how the community, through strong commissioning strategies, enable the hospital to be clear about what it needs to do and to what standard, and indeed what it doesn't need to do, and how we commission some health services from elsewhere, for instance from the UK or from Ireland or wherever it's best placed to be delivering that. So there are clear improvements. We need to work together with community health and social care to make the flows in and out of hospital better than they are, and indeed get really actively engaged in preventing the need for higher levels of health and social care in the first place.
You're having almost a love-in with the Minister at the minute. I mean, he was glowing about you, and you seem to be doing the same with him. But at the end of the day, you're going to have different agendas to some degree, because he's got to find cash, you want to do something, and whatever. Do you feel, was it too early to ask this question, do you feel you can make a big difference here?
We can make a massive difference here. I can help and do my part in doing that with staff and actually with Isle of Man residents, because it's our service. This isn't a private business. This is the island's health and social care service. I know the Minister shares that perspective. We can we can get to a point where we can do a lot of the things that and the aspirations that are wanted in the UK. We can more effectively deliver here, in my view, and that's why I'm here, because of that sense of community, because of that closeness with political decision making, because of the resources that we have, and absolutely, we all know about the demographic challenge, but we can better meet it.
What did you know about the Isle of Man before you saw that job advertisement? And was it the job? Was it? What was your reasoning for picking this one to go for? I mean, I presume you went for other jobs as well, no doubt, did you? You're looking for a change in career?
I was looking at probably the next big step in my career, the final step. I expect to be doing this for a long time, so it's not a retirement step, as you put it, but certainly something that brought together all the key strands of my career at that point. And after a while, as a practitioner, you get to see patterns, and you get to see actually this is how it should be. And I wanted an opportunity to put that thinking into an environment that where we can make those improvements. I had a relative here, an aunt, 20 years ago, lived in Douglas. I do remember visiting, and I remembered it as a beautiful place. But one of the key issues, it seems to me, for the Isle of Man is that there's a very little knowledge, accurate knowledge about the Isle of Man. It's certainly its beauty as an island and what it has to offer. I don't think that's known widely.
But this ageing population the Isle of Man has got, so I mean, the baby boomers are going through, and
Yes.
the Isle of Man's always attracted a retirement culture to some degree, and the amount of people working to pay those bucks to pay the health service is going to diminish over time.
Yes.
You know, a low tax environment delivering what you're saying there, which everyone wants, is a high quality service. Is it doable, or is that not your area to worry about?
No, absolutely. It's all our areas to worry about, because that interface between, you know, those in work and those not in work is a key factor economically, and you know, the economy drives all of the services that we can deliver. It's not unique though. There are many parts of the UK, many parts of the world that are facing the same dynamic.
I think what we're getting at is, will you be banging on the minister's door for more money all the time? I mean,
No.
or do you have to make do as
Absolutely
he told you?
not. Absolutely not. And this is an agenda that I am very familiar with in the UK. It's little known in the UK for obvious reasons, but actually there's been up to a 50% cut in public expenditure, particularly in local authorities, since 2010. If you ask the SIPFA and the various directors of local authority finances, will all agree that the combination of cuts from central government and all of the other cuts has taken resources down by 50%. So this discussion about how, and therefore the agenda that the UK have about how can we do more with less, is quite well developed. And we have to look at that here. The answer to problems isn't always about more money, more staff, more resources. We've got to try and make better use of the resources that we've got and make it work better for us.
Okay. Well, it's all about talking the talk and then walking the walk.
Indeed.
Maybe we can do this on a regular basis, update, maybe every few months or whatever you want, just to see how it's all going. Is that right with you?
I would very much welcome that. It's a good opportunity to speak to you, and indeed to speak to as many people as possible.